I really love oncology. We do so many things differently, and the experience for patients is so different. It's really rewarding. I'm Dr. Erica Hamilton, and I lead the breast cancer research program at Sarah Cannon Research Institute at Tennessee Oncology. My mom actually did have breast cancer when I was young, and I came up with kind of a special luncheon for senior girls, girls that are entering college, and just doing some general breast health awareness. When should you start mammograms? What's normal? What should you look for? And it turned into an event where moms were actually invited, so they really loved it. A little bit of quality time with their daughters before they went off to college the senior year. And then when I left school, it actually continued. So I was able to go back and kind of give the keynote address for the 20th anniversary of that, and it's still going on. So that's kind of a neat thing that's still happening in Charlotte, North Carolina. I worked at St. Jude in between my first year of med school and my second year of med school. And then ultimately, I really liked the conversation with patients and giving them all the information and options that they wanted, and really helping them come up with a plan that felt really comfortable to them, giving people some ownership back in a time that can feel really out of control, like you don't have a lot of choices. And so when I settled on adult oncology, breast oncology and clinical trials was just a really good fit for me. So my big passion around cancer care is clinical trials. And there's a big lack of understanding among most people in the United States about what clinical trials are about. A lot of people think, well, I would look for a clinical trial if I didn't have any options left, and that's just not the case. Clinical trials are appropriate at any stage of breast cancer diagnosis. We have clinical trials for people that are cured. We have clinical trials for first-line treatment, for late-line treatment. So really, at any point in the cancer journey, we should all be thinking about clinical trials. If you're a patient that just got diagnosed with cancer, hearing about a clinical trial when you're in the shock of now knowing that you have cancer and trying to figure out what does this mean in my life is not the best time to be hearing about a clinical trial for the first time. And so I think, one of the things I'm really passionate about is just clinical trial education, having clinical trials become a household name. I think one of the challenges around clinical trials is that they're not offered everywhere. And so that's one of our big missions here at Sarah Cannon Research Institute, is the philosophy that everyone should be able to access a clinical trial in the community where they live, where their support system is, where their children go to school, where they have friends and family that can help them. You shouldn't have to get on a plane and travel for a clinical trial, or drive 4 hours and stay in a hotel overnight. Even if your physician doesn't bring up a clinical trial, it's always appropriate to say, is a clinical trial right for me? If not now, then when may it be? It's really remarkable. Pretty much all of the drugs that we use now are within the past 20 years, and every single year there's something different and changing, which is pretty impressive because it means patients are getting better care year by year. We're really getting into our stride of true personalized medicine. It really just means that we're treating each person and their individual cancer and not treating them in a one-size-fits-all bucket. In terms of finding something that's gonna cure breast cancer or prevent breast cancer, that's probably unlikely, because breast cancer is really a continuum of hundreds of thousands of different diseases and reasons that they developed. You can never decrease your risk of breast cancer to zero. You can do certain things, like exercise or have a healthy diet or go get your mammograms that might be able to reduce your risk or find it earlier. But no one can take their risk to zero. And so I think we have to be really careful about the way we talk about breast cancer and being really precise with our wording about risk reduction for an individual, maybe prevention as, a population as a whole, but not making it seem like an individual did something wrong to get cancer. The vast majority of cancers are not gene-related. We hear a lot about BRCA1 and 2 in the media. And so that's a question that I hear a lot of people say is, what did I do wrong? I think the big take home is that it's not your fault. Most importantly, I hope my legacy is that I raise 2 happy children. I like the fact that my daughters see women in various career paths and realize that they can do anything. I often tell them that, a boy can do anything and a girl can do anything. If you set your mind to it and work hard enough, anything is possible. Second, most importantly, is that I treated patients well and that I made a difference in people's lives. And then probably third most importantly is that I advanced the way breast cancer is treated for millions of women to come in the future years through clinical trials and advances. So maybe somebody that's diagnosed with breast cancer in 30 years has a much easier experience and journey than somebody that's diagnosed today. I'm Dr. Erica Hamilton, and this is my life, my legacy.